the two major components of emotions then are the body feelings and sensations, as well as the inner thoughts. So we want to differentiate between these two things when we're working with emotional conditions, because the exercises that we're going to be doing then are aimed at bringing people's attention to the sensations and the feelings in their body with mindfulness. Okay. Let's move on to the next slide, because this gets into a lot of the material here. So when working with somatic therapies, there's what I call the big four. And these are the four primary methods that you can use that help people to be embodied and put them in contact with the feelings and the emotion as it's held in the body. Okay. So the first one, and in some ways the most fundamental one to begin really in-depth work with somatic therapies, are what I call the sensory orientated methods and body awareness exercises. Okay. And what this involves is it starts by feeling into the subtle sensations and the feelings that we have in our body. And then we, as therapists, we need to ask probing questions that involve the quality of the sensations and the feelings. So earlier I spoke about how there's often disconnect in today's world and with people. So many people are living in their heads, and their mental activity is excessive, and the monkey mind is going wild. And many people are disembodied as a result of overactivity in the mental space. Okay. So I'm always surprised when I do these practices and other practices, just how disconnected people are from their bodies. Like, there's people that will do some diet or some exercise program, and they haven't even checked in with their body to see if that's best for them. And they're making their decisions about their diet and their food, their nutrition, their exercise based totally on their mind and what they read or what they thought. And they're not even taking the time to check in with their body to see what's best for their body. Okay, so I think we all agree that there's a big disconnect here between people's minds and body, and how frequent and common it is for people to be in mental activity more than in embodied experience. And this is partly why practices like Qigong and yoga are so valuable, is because they help us to be present in our bodies and to have more body awareness. And as we cultivate more body awareness, then amazing things start to happen, not only on the physical level, but also on the psychological level, and also with this bridge between the mind and the body both. Okay, so these sensory orientated methods, they begin with bringing people into body awareness and then asking these probing questions. So example, one question you can ask is, where do you feel this emotion or this feeling in your body? Okay, and this is really a fundamental thing, is asking people where they feel their depression or where they feel their anxiety. When you ask that question to people, some will say they feel the anxiety in their abdomen. Other people say they feel it in their heart or in their chest. Other people feel anxiety in their neck and shoulders. And some people don't even know, because of that mind-body disconnect. So one of the first questions that we want to ask is, where do you feel this in your body? You can ask that about depression. You can ask that about any sort of emotional condition, irritability, grief. And I'm amazed at how different it is for everybody. Now, there are some core areas and some common areas that we're going to discuss where people feel these emotions. But when you ask a question like this, it starts to personalize the treatment as well. Okay. So other examples of these sensory oriented questions are, what does the grief feel like in your body? Okay. Or what color is the tightness in your chest? You can also ask about memories. You can ask a question like, are there any memories associated with the anxiety in your chest? And when you start to ask these questions, and if people are really fully present in their body, and if they're getting an answer from their body, then this is where the magic starts to happen. This is where stuff starts to surface from the unconscious. This is where we start to enter into what we can call the felt sense. This is where they start to get intuition about how to solve their own problems. So one thing that happens as therapists is we often, we've gone into a line of work where we want to help people. But it's also very essential to teach people how to tap into their own inner resources so that they can find the solutions for themselves. Because one thing that psychologists and coaches know is that if you can find solutions for people by leading them to find those inner solutions within themselves rather than giving advice, that they're much more likely to see results. Okay. So that's the first method of the big four when working with somatic therapies, is getting people to feel into their bodies and then asking these sensory orientated questions. Okay. And body awareness, putting people into the subtle sensations and the subtle feelings of the emotions as they're held in the body, is a primary and essential thing to do. Now, another method that we can use in one of the big four is working with the breath. And the breath is the bridge between the mind and the body. It provides a physical basis for body-oriented practices, and it can serve as a resource point or an anchor. Now, if you don't know what a resource point is, that's something that we'll discuss further. But basically, it's like a safe zone. Okay. So if someone is stressed or anxious, if they have a resource point, and that can be the breath, then that can serve as an anchor for more mental stability, more calmness, more clarity, and it helps to reduce emotional reactivity to have these things. Okay, so later on, I discuss about a dozen different ways to help people find anchor points. The last sentence here, it reads, breathing and heart rate can be used as biofeedback and can even modulate brain oscillations. So when you start to work with the breath, that has the potential to reset our biological rhythms. You can calm your heartbeat down through working with the breath. You can come to a state of presence in the moment through the breath. And there's a lot of advantages to it. I'm not going to go into a lot of detail right now. I do speak about working with the breath in the course, but I want to continue to move on. And I've also done a lot of breath work and have assisted in a lot of breath work as well. And if you've never done breath work, it's incredibly transformative. I would suggest that you go out and find a local person doing breath work and do a session of it, because it is incredibly powerful for helping people to release emotion from their body and to get therapeutic results in a multitude of ways. Okay, the third point here, and also one of the big four, is touch. So touch is incredibly therapeutic, and it can be used as a way for working with somatic conditions as well. You can use gentle touch. Massage does this. I remember the first massage I ever had, I was crying like a baby about halfway through it because it was releasing a lot of emotion that I held in my shoulders. I was young at the time, had no idea what was going on, but it was amazing to just experience that degree of emotional relief from something as simple as just a shoulder massage. Qinei or abdominal massage is incredibly powerful for helping people to unravel the emotion that's held in their body, because a lot of people hold emotions in their abdomen. Okay. And one of the therapists that I've done some interviews with that is in the course, her name is Daisy Kay. She specializes in Qinei and abdominal massage, and it's one of her primary methods that she uses to resolve emotional and psychological conditions for people, because of the way in which so many people hold their stress and their tension and their emotions there. EFT, emotional freedom technique, uses touch with acupressure and affirmations. This is a very good system that you can easily give to your clients and give them tools that they can use. And then we also want to distinguish between self-touch and touching the client. So you can prescribe and teach your clients how to do simple touches. Like right now, everyone just do this too. Let's get a little more embodied. Been speaking for a little while. So just before we do this exercise, just close your eyes and take a few deep breaths and just relax into your body. As you inhale, feel your breath moving down towards your abdomen. And then as you exhale, just gently sigh or allow yourself to settle into your body on the exhalation. And just notice how you feel right now at this time. You may have noticed that the breath has brought you to more presence or more calmness, or it may have changed your psychological state in some way. Just even taking a few breaths can do that. One more time, breathe in and direct and guide the in-breath down to your abdomen. And then as you exhale, feel as if you're settling into the lower dantian and into your lower belly. Now, take note of where you're at. Take note of your inner feelings. And what I want you to do now is place one hand on your heart and one hand on your abdomen. And just notice how that simple touch, placing one hand on your heart and one on your abdomen, just notice how that very simple touch changes your state of mind and your overall feeling. Did it bring more presence? Did it bring more of a sense of calmness or clarity? How did that simple touch affect you just now? So, very simple exercise. And anyone care to comment on what they experienced when they did that? Okay. So let's go ahead and move on. And the last part of the big four is movement. Okay. So moving the body can be incredibly therapeutic and work in addressing emotional and psychological conditions as well. So much so that there's a whole system of healing and working with trauma called TRE, trauma release exercises, that works with movement, as does somatic experiencing by Dr. Levine as well. He works a lot with movement. Yoga therapy can be classified as a form of movement, and then dance therapy as well. It's absolutely wonderful and beautiful form of working in a somatic way. And I've had the opportunity to work with some dance therapists, and Daisy, who I mentioned earlier, who's in some of the interviews in the course, she is also a dance therapist and does somatic therapies. And I've literally watched her take hundreds, if not thousands of people into dance and have therapeutic processes with that. And she combines that with breath work and abdominal massage. And it's really incredible to see the transformation that can happen when you combine a few of these things. Okay, let's take a look at the next slide. I need to keep aware of the time here too. So it's just a diagram showing the big four. So we've got the breath, the sensory methods, the movement, the touch, and then I've put talking therapies down here too. Okay, so one thing I want to talk about, and it's a good place to start as well, is interoceptors. So these are special type of sensory neurons that allow us to feel into our body and to feel our viscera. Okay, so when you close your eyes and feel into your abdomen or your dantian, or if you feel into your heart, then those internal sensations are coming from these interoceptors. And these things are really incredible because they have a strong connection to our emotional being as well. Okay, and they're even finding that it connects to our sense of self. So the second point here reads, interoceptors are strongly connected to our sense of self. There's a link to an article there. And then there are also links between a lack of interoreceptor awareness, or we can just say body awareness. There are links between a lack of body awareness and emotional disorders, depression, PTSD, and substance abuse. Okay, so those who don't have body awareness, there are correlations that suggest that they have higher rates of depression and emotional disorders and PTSD, okay? The next point reads, interoceptors play a role in emotional self-awareness and are associated with good qualities, such as better leadership qualities and improved success. If you're interested in that, I'd refer you to Emotional Intelligence, the book by Daniel Goleman, okay? So what this suggests then is that with greater body awareness, we can improve our chances for success, we can have better leadership qualities, and even be less likely to experience emotional disorders and depression. So all of this points to the importance of cultivating body awareness. And the last point here, I just want to read this one as well. It says, being aware of inner body sensations and feelings helps regulate emotional responses. Okay, so if you're aware of your body, then you'll be better able to regulate your emotions. And a lot of work has been done on this in the field of dialectical behavioral therapy. And one of the first things that they teach in their system is mindfulness and body awareness, okay? And then after that, they have a whole system that goes into distress tolerance and into emotional regulation and interpersonal communication skills. So mindfulness and body awareness is really a core foundation for good emotional health, as well as for emotional regulation. Okay, and I'm just going to kind of quickly go through some of this because I do want to make sure that I get to some exercises. So there's this link between physiological regulation and emotional regulation as well. So if you can regulate your physiology through your breath or through your heart rate, if you can regulate your physiology through bringing awareness to your body, then that helps to regulate the emotions as well. And these are all things that we can teach our clients, and they're really quite simple, even just learning to breathe in certain ways. Now, one thing that some of the doctors and researchers know that specialize in breath is that if you extend your exhalation, that actually induces a parasympathetic response. Whereas if you emphasize or extend the inhalation, that activates a sympathetic response, okay? And we can try this out just now. Let's do this by taking a long inhalation. I need to do this because it's late here and I'm in Vietnam. So I kind of need to wake myself up a little bit. I'm feeling a little hoarse and dry from speaking all day and whatnot, but we're going to do this sympathetic activating breath. So the technique that we're going to use is we're going to take a longer inhalation. And then when we exhale, we're just going to allow the breath to drop out quickly, but not forcefully. So we're going to go a long inhalation and then just naturally relax on the exhalation. And we're going to make the inhalation so that it's longer, and it should be at least twice as long, or maybe even 3 times as long. So try this now. Let's try this a few times. Inhale long, and then just relax short. Okay. Now, when you extend the inhalation and make it longer, that's going to increase sympathetic activity. So you may notice that you feel more alert now. Okay. Now, if we extend the exhalation, that's going to induce a parasympathetic response, and it's more calming and relaxing. So let's try that now. So to begin, we're going to inhale with a count of 4. So inhale 1, 2, 3, 4. And then as you exhale, either count to 6 or 8, because we want that longer exhalation. Now, I'm still feeling that sympathetic response, but try this on your own. If you need to relax and calm down, if you're in the middle of a frantic and busy day and you got just only 30 seconds, do that. Extend your exhalation, because it's going to induce a parasympathetic response and it's going to calm you down. But if you need energy, or if you have a client that's low on energy, you can teach them the inhalation methods, which activate the sympathetic response. And this is something that, I find it works as good as a cup of coffee, and sometimes even better when I do these breathwork exercises. And it doesn't have to take long, even just 2 or 3 minutes of conscious breathing in either direction for the sympathetic response or the parasympathetic response. Just 2 or 3 minutes of it is life-changing. Okay. All right, let's continue on. So mindfulness, really important practice, and it really forms the core foundation of some of these somatic therapies. Okay. And what do I want to say about this now? I want to make sure that we have enough time, and it looks like we're getting into it. So mindfulness involves bringing one's awareness to the present moment in a non-judgmental way. Okay, so when we have a focal point, such as within our body, then that becomes a point of concentration where we can enter into present moment awareness. So just by paying attention to our breath, breathing exercises are a way to cultivate more mindfulness. And they're a very common way that are widely spoken about and widely written about. Now, another way to do this, though, is by observing body sensations, or we can observe our feelings, we can observe our thoughts, we can even observe our beliefs. And this is getting into some of the material that I want to share about what's called the witness or the observer, which all equate to Shen and spirit. And this inner witness, this inner observer that we all have, is even equated to Buddha nature in some of the Buddhist teachings. Okay, so this is something that is really easy to learn, and something that we can cultivate on a moment-to-moment basis, and something that plays a real fundamental role in working with somatic therapies. Because if we can just take a moment to step back and to observe our feelings, or to observe our body, or to observe our breath, then we get some space with whatever's going on. So let's say that you're feeling stressed because it's been a long and busy day. And if you know how to do these practices, if you know how to go into that inner witness, if you know how to step back from the mind, or from the monkey mind, if you know how to step back from the feelings of stress in your body, then you start to get space, you start to get calmness, you start to get clarity, you start to get presence. And this is mindfulness, and perhaps even Buddha nature, or Shen as well. Okay, so I think I want to go right into some of the exercises. So let's go ahead and do this. And I'm going to take you through a little sequence here where we're going to simply begin by observing the breath. So let's return to our breath, and we're going to breathe into the lower abdomen. And let's extend the exhalation as we did before. So make your exhalation a 2 count or a 3 count longer. And notice how a part of you can observe the breath. Notice how you can observe it as if it's a process that's even outside of your state of awareness. Now, as you observe your breath, do you feel as if the totality of your being is the breath? Or is there some part of you that feels distinct from the breath? Notice whatever sensations are present in your abdomen. That might be subtle tingling, maybe it's subtle warmth. Notice any subtle vibrations that are present in your lower abdomen. And who is this that's conscious of the lower abdomen? Who is this that can observe this process? Now bring your attention to your right hand. And just notice whatever sensations are present at your right hand. Notice any tingling or subtle vibrations that are there. And notice how the inner observer or the inner witness can observe these processes without being totally identified with it. Do you feel as if the entirety of your being is within your hand? Of course not. Can you experience your hand as if it's an object? And now, whatever your next thought is, notice that there's a part of you that can observe that thought. Notice how the thought rises into awareness and then continues for some time, or maybe it drops away. So who is this that can observe the arising and the passing of thoughts? For any given thought that arises, do you feel as if the totality of your being is within that thought? Is the totality of who you are as consciousness totally identified with that thought? Is that all you are? Is that thought? Or are you more than that? Can you observe your thoughts as if they are objects? Bring your attention back to your breath. And now this time, guide your breath and your awareness to the heart center. Noticing any subtle sensations or feelings that are present there. Now, as you guide your in-breath to the heart center, ask yourself, who is this that's observing this process? Who is this that perceives those subtle sensations in the heart? Bring your attention back to your breath. Inhale. And this time, do so with intention. Do so as if you're guiding your breath into the heart center with a sense of offering gratitude to your life, with a sense of honor and reverence and self-love. Guide your in-breath to the heart center with those qualities, offering your breath to the heart with a sense of thankfulness for this gift of life. With a sense of self-love, self-compassion, with any positive quality that you need. Inhale with the intention of directing that into your emotional center. As you exhale, settle into those subtle sensations and feelings. Settle into that warm, positive regard and into that reverence, that honor, that love, that respect that you have for yourself. Okay. Open your eyes and just take a moment to Wiggle your fingers and toes. Just come back into your body. So I've guided a lot of meditations like that in a meditative sense of teaching meditation, as well as in a therapeutic sense of working with clients one-on-one. And this is one of about a dozen different techniques that I teach in the full course, is cultivating this capacity to be within the inner observer, or to be within the witness, to be within the spirit, to be within the Atman, or the Sakshi, as they call it in the yogic and Vedantic traditions, to be within Buddha nature. And if you dive into these Eastern traditions, you'll find this is a reoccurring theme, that we have this ability to step back from our thoughts and our emotions and to observe them in this way that we just did. And there's a lot of different ways that we can do this. We can do it through observing body sensations and feelings. We can do it through observing emotions. We can do it through observing our thoughts, our beliefs. And this, again, it forms a fundamental part of what I teach in this class. And there's a lot more. There's a lot of other techniques. There's about a dozen of them that I'm teaching in this. But this is one of the core ones. And it has a lot of applications as well. I also use this in a process called voice dialogue, which is the psychological side of working with somatic therapies. Because let me get to something else here. Let me show you. So when I'm considering treating people for anxiety or depression or trauma or any type of condition like that, I'm always asking myself, what is this person going to be most responsive to? What's going to benefit them the most? Of the big four treatment methods that we talked about, the sensory related methods, touch, breath, or movement, I'm always asking, what's going to work best for this person? Maybe the breath is going to work best. Maybe the breath is the best technique to use to bring them to presence. Maybe the sensory orientated methods and questions are the way to bring them to presence and wholeness. Maybe exercises like we just did to cultivate the inner witness is the best method. You know, everyone's different, so you've got to find what works for each person and what they're most receptive to. Sometimes some of these techniques will re-trigger things. People get triggered by bringing awareness to their body sometimes. And that has probably happened to you when you've done acupuncture. You put a needle in someone and then, you know, they feel that needle. So their awareness is going right to where you put that needle in. And then they're not used to having their awareness there. And then they have an emotional release. And then what do you do? Well, that's what I'm teaching. Okay, that's how to deal with situations like that. Now, for psychological conditions, you know, oftentimes we do need to refer people over to other professionals because sometimes it's outside of our scope of practice. But this ability of cultivating the inner witness and the ability that we all have to go into that state of consciousness in any moment, we can all access that. It's only ever one breath away. Okay. In the Eastern philosophies, they teach that that state of consciousness of the inner witness or the spirit, it's always ever present. Buddha nature, it's always ever present. We just have to remember it and attune ourselves to it. Okay. And as I was saying, you can use this in a variety of ways. You can use that inner witness in the body-orientated methods, the big four. I also use it a lot in voice dialogue, which is a method that I use that works more on the psychological side of things, and which I learned from a Zen practitioner. So we're about out of time. I think I want to start to sum some things up, but here's another important thing that I want to show you. So as Chinese medicine doctors, we're often used to thinking of the 5 elements and the emotional associations there. So anger connects to the liver, and then, you know, joy goes to the heart and the fire element, and worry affects the spleen. So in Chinese medicine, there is this association between the emotions and different parts of the body. Well, I'm going to present something else here that's kind of related because there's a lot of interesting connections and correlations we can make. However, I suggest that when working with somatic therapies and working with emotional conditions with your clients, is that don't rely too heavily on that, because when we guide them into these embodied experiences, we want to do so in a way that they have their own experience with it. Okay, because not everyone holds anger in the same way. Some people hold anger in their temples, some people hold it in their neck and shoulders, some people hold it in their chest. And so I don't like to tell my clients too much about the TCM, emotional associations with the liver, because that's a whole different language that they don't speak. Rather, I want to give them a fully embodied experience where they experience for themselves the way that they're uniquely holding emotions in their own body. But generally speaking, there's 5 key areas where people hold emotion. They can hold it in their head, face, and jaw. And the jaw is a very common area, and that's that liver relationship that we speak of. The second area is the neck and shoulders. The third area is the chest, heart, and thoracic cavity. The abdomen and the digestive system are the fourth, and then the hips, pelvis, and the groin. So these are the 5 key areas where people hold their emotions. And when you guide people into these processes that I teach, then you want to understand where they're holding it. And this is one of the fundamental things that I'm teaching now too, is asking your clients this question: where do you hold your anxiety? Where in your body do you feel your grief? Where in your body do you feel your worry? So by asking questions like that, and then guiding them through processes, through working with the breath, or through using touch, or through using imagery. Now, imagery isn't something that I really go into a lot in this class, but some of you are probably into it and maybe use it. But you can use imagery. I classify that as a sensory oriented process. So when you use these methods to help people discover where they're holding their emotion, then you're going to get better results. You're going to have people having releases and shifts. They're going to have a catharsis. They're going to experience their body in a whole new way. And when you are really proficient at taking people into having an embodied experience and helping them to discover where they're holding their emotions, then the psychological stuff will kind of start to sort itself out a lot of times. And if you dive into somatic therapies, and if you're familiar with the work of Dr. Levine, Peter Levine, who wrote the book Walking the Tiger and is a trauma specialist, if you dive into these somatic teachings, what you'll find is that for a lot of cases, the answer is within the body, because there's an innate wisdom and intelligence there that can guide people in not only releasing the emotion, but also finding the solutions to their problems as well. And this is something that I'm teaching in this course, and this is connected to the felt sense as well, okay, which is essentially feeling into the body, locating it, and then learning a new language. One thing that we want to do is we want to teach our clients how to express that emotion from a body level. Because when they come into our clinics and they're talking and they're telling us about their anxiety, they're telling us about their grief or their depression, they're in their minds. They're telling us the story. And what happens is they get trapped in that. And they're in that repetitive cycle of the mind. So we need to break that identification by giving them an embodied experience and by teaching them to cultivate their inner witness. And then a lot of things will start to unravel. And it's quite incredible to see these processes because they're very easy to learn and they're very effective. And I'm amazed at, I always make a point when I'm treating psychological conditions and anxiety and emotions to ask if people are seeing a counselor and to ask if the counselor is doing any somatic-based treatments. And oftentimes they're not. Like a lot of them are just doing talking therapies. Certainly some of them are, but many times I've been surprised at how few therapists are doing somatic treatments like this. So this is something that people need and something that we can offer. This doesn't take a lot to learn. You can learn this stuff really quickly. And after you've done it on a few clients and you've seen the results and they've had the emotional releases, they're going to be thankful, and it can literally transform your practice as well. Okay. Now, some of the things that I'm teaching here too, I bring back to our understanding. I talk about some internal, external exercises that you can do and a number of other things. So I talk about key points for communication that are essential in doing this type of work. I've also mentioned Marshall Rosenberg and nonviolent communication and how it's important to get to the underlying unmet needs that are a part of people's emotions. Okay. And let me just give you a quick preview here. I've got a 40-page PDF file. I break everything down very clearly so that you can understand, how imagery works and where I classify that. Imagery can be a great method to use in these processes. It's not one that I go into in this, that's a whole other thing. But if you're doing any sort of guided visualizations or imagery with your clients currently, this course will give you a big picture perspective on where that fits in and how you can complement it with other things like breathing and questioning and sensory orientated methods. Okay. So that's about all we've got time for now. I am going to post this, and I'll probably need the weekend to put it up and put it on my site. So I will be recording it. It will be up. It will be available. Look for an email coming out this weekend or Monday. And then I'm also offering a course with this as well, the full course. It's about 3.5, 4 hours of audio recordings. There's a couple hours or maybe 3 hours of video recordings. I've got interviews with Daisy. I've got interviews with a counselor who I've worked with. I've worked with both of these people for about 10 years, and they've really made some nice contributions to helping you understand how to work with people at this level. And there's a lot of other good stuff in there. I present a 5-step system. I'll give you a quick view of it now. So let's see. Here's an overview of the somatic processes that I'm using. And this is really sort of the core of what I'm teaching. There's 12 different methods that I teach, but this is really the cornerstone of it. And it's a step-by-step process. So the first step involves orientating your client and making sure that you've established enough trust and rapport and safety. I also talk about resource and anchor points and how you may or may not need to establish those at the beginning of doing this work. And one of the key things that we want to do, as I've mentioned, is have the client locate the emotions in their body by asking them a question like, where do you feel this emotion in your body? That's the first step. And then after that, we want to inquire and explore, and we want to take them into that fully embodied experience where they're experiencing their emotion from the body and not just from all the verbal dialogue that's going on all the time. Okay. And then the fourth step is when shifts start to happen, or when they have opening, releases, or catharsis. And then we speak about how to finish and how to resolve and how to have dialogue that's embodied. Okay, so we want them having a embodied experience emotionally and to be able to communicate at that level rather than just from the monkey mind and from the mind that is overactive and stressed and doesn't know what to do. Okay. So the other thing that I'm going to put in with this course then is it includes 2 live sessions. So I want you to learn this material and learn it really well. So we're going to do some live presentations where you can ask questions. Ideally, it would be good to go through the material first on your own and then, get an understanding of it. You can listen to the audio files, you can watch the videos, and then we'll do live trainings like this where you can ask questions and we can go through the process. And I would like it if someone was willing to be in the role of the patient. You know, we can do one-on-one work like that, or we could even do group work similar to what I did with guiding you into the inner witness or the observer. So I think after a couple sessions of that, you're really going to have a strong handle and you'll be able to start using these techniques right away. Okay. So any questions or comments?
I thought it was, this is Marlene Millie. I thought it was very interesting when you mentioned the effect of exhalation and inhalation on the sympathetic and parasympathetic system, because if you actually put your hand over your chest where the heart is while you're inhaling, you'll notice that the heart rate does go up. Oh. And when you're exhaling, the heart rate does go down, decrease.
Yeah, fantastic. That's amazing that you did that with the touch and you felt it. That's exactly what we want people to do. Mm-hmm. Amazing. Very good. Thanks for sharing that. And, you know, you can do things like that with people too. It's a form of biofeedback, is you can have them feel their pulse, you know, while they put a hand on the chest, and that can help as well.
Right, correct.
And then they can start to regulate. So that goes back to that comment about physiological regulation is emotional regulation.
Right. It's very good.
Yeah, these are really great practices. And, you know, another thing that I've found with this too is that if you're doing TCM and just doing acupuncture and herbs with people, it has its strengths, right? Like acupuncture is amazing, but it has its limitations as well. But when you start to offer things like this to your clients, then it's going to engage them more. Okay. If they're just like the passive patient, it's laying there and, you know, you put in some needles and they don't have to be very involved with it. Like the results of treating emotional and psychological conditions is only going to go so far. You really have to get them engaged in the process. And that's what this work does, is it engages them in a very real, physical, embodied way. Anything else? Questions, comments? All right, well, if that's it, then thank you everyone for attending. I really enjoy sharing this material. It's very transformative. And as I've said, I've drawn from a lot of different sources, and it's not only to be used in a therapeutic sense, but you can also use this for your own personal growth and development. You can also apply a lot of this stuff to meditation. You can apply it to Qigong practice. You can apply it to your yoga practice. You can apply it to however you make dietary choices. You can apply it to how you design your exercise program. There's so many ways that you can apply this material. But we'll be speaking of it primarily in the therapeutic sense of working with clients. But I will also draw in some of the stuff from the meditative schools, because I think that's really important for our own health and well-being as well. All right, well, if that's it, then let's see, let me just read this. All right, well, I'll be sending out some emails and some links. Keep your eyes out for that, and I look forward to sharing more. Have a good day.
Thank you.
You're welcome. Bye-bye.